بياخدوا حاجة سريعة مش اللي
First layer is named loose annular tissue. Fifth layer is named pericranium. What about the plane of collections and movements? Fourth layer, it is the layer which allow or give the chance for mobility of the upper three layers or the fifth layer. And the most common layer for collections. What I mean by collections? Fluid, whatever blood, whatever. How can you differentiate between bulge in the skull? What I mean by bulge, hematoma. Closed type of the head trauma. We have major types which are sub-aponeurotic and sub-periosteal. What is the character of each? يعني جالك طفل صغير بقى كده في سن 5-6 سنوات في العياده ومامته جايباه كده دي بالج خلاص كده من اول ما كده الكونفيوجن بتاعتي ازاي تقول ان دي سب-periosteal ودي sub-aponeurotic. أنهي واحدة ألاقيها localized sub-periosteal. Sub-periosteal hematoma is localized. Other type is diffuse. نسميها sub-aponeurotic. That's right. Which type never cross sutures or midline?
Periosteal.
Sub-periosteal. Some students asked me yesterday, what about treatment for head trauma? First of all, head trauma, with this bunch, you should exclude the major effects, which is fractured skull bones and intracranial hemorrhage, which is so severe and so fatal. That's why the first procedure you make exclusion for this. From the history, if the patient informs you that he had concussion, what I mean by concussion? Loss of consciousness. الحوادث دايما كده بتأكد على السؤال ده. هل أنت فقدت الوعي؟ Transient loss of consciousness, what I mean concussion. So you should exclude this from the start by history and making limb X-ray to exclude the skull bone fracture and intracranial hemorrhage. Otherwise, there is no loss of consciousness, there is no concussion, and the skull bones is intact, you are running for hematoma. Whatever sub-periosteal, whatever sub-aponeurotic, usually the treatment is conservative. يعني بنقول للأب يعني بتعملي له كمادات متلجة شوية cold compresses, and then from the next day you can make hot compresses. That's right, to help absorption of that blood. Today, inshallah, we'll continue the face, and we started yesterday. The muscle of the face have a common criteria. This is a very important slide. A common criteria. What is common criteria? Number one, all these muscles are located. All these muscles are located immediately underneath the skin, so they are located in the level of the superficial fascia. Number two, they take origin from the different bones of the skull, bones in the face, whatever maxilla, nasal, whatever, and inserted directly in the skin of the face. That's why they move the skin in different directions, producing what I mean the facial expressions. All these muscles are starting in embryology from one source. That one source is the branchial arches. These branchial arches, the second one, it's a core mesoderm, will be responsible for the formation of all muscles of the skull, and all muscles of experience some muscles scattered in the neck, and also one muscle located inside the medial cavity. One muscle located in the neck, flat layer here, platysma. Later, inshallah, we'll know a muscle here named digastric muscle. It's a posterior belly, and another muscle named stylohyoid muscle attached between the styloid process and the hyoid wall. And the other, or the last muscle located inside the middle ear, is named stapedius. Actually, in the middle ear cavity, I mentioned before, we have 3 ossicles, 3 small bones. مترقب السندان والحاجات دي كلها. لما ناخد الاير, you will know also 2 muscles acting on the joints of these bones. One of them is named tensor tympani, يعني من اسمها بتخلي الدرام تنس. والسكند one ماسكه في الستيبس بنسميها stapedius. So from there, what about muscles derived from the second arch? Number 1, muscle of the skull. Number 2, all muscle groups of the face, including auricular muscles, what I see today. And the other muscles scattered in the neck and the middle ear, which are platysma, posterior digastric, stylohyoids, and the last muscle inside the middle ear is named stapedius. All these muscles are innervated by single nerve, which is facial nerve. Okay? So, this is the different variations of the facial expressions, and we will see in sequence, in brief, which muscle is responsible for each variant of this. This is the facial nerve, and as we know, facial nerve gives exit from the cranial cavity through a facial foramen. Remember, خرج ازاي من السكال؟ From the base of skull we had before a stylobastoid foramen. Excellent. A stylobastoid foramen give passage for only facial nerve. Immediately below the stylobastoid foramen, it will give that branch which runs behind the auricle to supply muscles of the skull behind, which is occipital vein. And 2 of the muscles of the auricle, as we will see today. And then go inside the parotid gland. Finally, give these 5 terminal branches. In sequence, كلنا دايما بنمثلهم كده ب5 صوابع خارجين من البارotid gland. In sequence, we have temporal branch, zygomatic branch, upper and lower buccal branch in relation to the parotid duct. And then we have mandibular branch. Lastly, we have cervical branch which runs to supply the platysma. So, in cut walls of the face, خدنا قبل كده cut walls في السكالب. Also, cut walls of the face bleed much, but not like the area of the skull. But what about the danger of the cut wounds of the face? You are careful about what?
Scars.
These nerves. Otherwise, muscle paralysis, facial muscle paralysis. Which type of the cut wounds is more dangerous than the other? We have variants. يجي الراجل كده يقول لك ايه علم عليه. ها؟ Vertical or transverse? Why? So, vertical will affect large number of nerve fibers. Transverse, sometimes nothing occurs. ممكن يمشي ما بين الاثنين. That's right. ده هو right. So, now, we will go for different group of the muscles. This is the common criteria of what I said. Actually, due to their arrangement around the openings located in the face, either dilate or constrict these openings. That's why they are described as gluteal muscles. انها تفرزها بوابه. Okay? We have group of muscles. Number one, muscle related to the orbit, so it is named ocular group. Second group, nasal. Third group around the mouth, named the oral group. Auricular group attached to the external auricle. To the auricle. Lastly, others like platysma and occipitofrontalis. What ocular group? We have just two muscles. The main one, yes, the ocular group, we have two muscles. This one, which encircling the orbit, named orbicularis oculi muscle. This orbicularis oculi, and the second one here is named corrugator superciliare. Hint on the corrugator superciliare. Just the name. But from its name, what about its action? Corrugator, so mean what? كشكشة بالبلد كده. الكشكش. Corrugation. Superciliare, what I mean by superciliare? The eyebrows. The structure located above the cilia. Cilia is the eyelashes. Okay? The structure above the cilia is your eyebrows. So, imagine that origin and insertion. This is the origin. And this is the insertion. It originates here from the medial part of the superciliary arch. العظمة نفسها. But about its insertion in the medial part or the medial half of the skin of the eyebrow. One right and one left. That's why make movement of the insertion towards the origin. What happens for the eyebrows? So it approximates the two eyebrows towards the midline. What happens in between? الفور هنا تلاقي فيها wrinkles. What type of wrinkles? Vertical wrinkles. Which muscle was producing transverse wrinkles? Occipitofrontalis, which be acute frontal. So I will shift now for the orbicularis oculi muscle. Actually, it is divided into three parts. First part was located inside the material of both upper and lower eyelids, you see. It is named palpebral part. Palpebral equal eyelids. Second part, encircling the bony orbit. It is named orbital part. Simple. Origin and insertion. We have here a transverse ligament and another one laterally. So they are named medial and lateral palpebral ligaments. The palpebral part originates from the upper border as an origin and then inserted in the lateral palpebral ligament. Again, the palpebral part located in the lower eyelids similar to it, but from its lower border. So, regarding palpebral part, it has interrupted course at the medial and lateral palpebral ligaments. On the other hand, as we see, the orbital part, it has an interrupted course. It starts medially from its origin and make a complete circle to insert it again in the medial palpebral ligament but lower border. So, this orbital part forming an interrupted ellipse around the bony orbit. What about the action of the two parts? Muscles are guardians. So this one is occlusion of the eye. But which type of occlusion? You are in need for two types. During blinking, اللي هي الرمشة اللي احنا بنقول عليها, and during sleep, this type of occlusion is gentle occlusion. But when you are facing danger, you are forced occlusion. You are need for forced type of occlusion. That's why the palpebral part will give you gentle closure in blinking and sleeping. But both of them are asked to contract in the fourth type of closure. Actually, this muscle, it has a third part. The third part will be taken in the course of the orbit. Why? Actually, it is attached to the lacrimal sac where the tears are accumulated or stored. That's why it is responsible for the drainage of the tears. So the third part is named lacrimal part. So again, orbicularis oculi, we have three parts: orbital and palpebral, and inside the orbit we have the lacrimal part. I will shift for the little group. Many students ask me, Doctor, we see in the first slide large number of muscles in the face. Don't worry, we are in need for just common criteria, and I will explain the name of the muscles and hint about their action. But finally, the common criteria, what you need. That's right? So, I will shift now for the nasal group. زود شوية. Three muscles. First one we have is nasal, procedius. And second one is nasalis. The third one here is named depressor septi. What about procedius? Simply, vertical muscle fibers, as you see, start here as an origin from the nasal bones. And its skin insertion in the skin of the lower part of the forehead. يلا حرك لي كده الانسرشن في اتجاه الاوريجن. This is the origin, bony origin. And upward we have the skin insertion for the lower part of the skin of the forehead. What happens in the skin of forehead? Yes, showing again transverse linkage. That's right. Similar to what? The frontal view of septofrontals. Second muscle we have is named nasalis. As we see, nasalis, it has two parts. One covering the dorsum of the nose, and its fibers running transversely, named transverse part. The second part is attached to that lateral part of external nose. الحته دي بيسموها ايه؟ عندنا كده زي الجناحات، بيقولوا عليها ايلا اوف ذا نوز. السكال انت شفتها من غير كارتج. That's right? So the external nose is formed by nasal cartilage. Whatever the movable part of the septum and the nasal lateral cartilage or lateral nasal cartilage. That small part is named ala of the nose. That's why this part is named the alar part of the nasalis muscle. We can see another figure. So this is the complete procedius muscle attached between the nasal bone and the skin of lower part of the forehead, making transverse wrinkling. And we have nasalis muscle. That part is the transverse part. You see? Originates from the front of the maxilla, just lateral to the nose, and the making cross to the opposite side to share with its fellow on the opposite side in a common aponeurosis covering the dorsum of the nose. العضلتين قبل بعض كده بالعرض اللي بنسميها transverse part of nasalis. شغل بقى العضلتين سوا، ايه اللي يحصل في النوز؟ compressed، اكنها بقى ايه؟ قفلت. compression of the nose. Compress the nose. On the other part, or the other hand, the part which is named the other part of the nasalis muscle attached to the front of the maxilla, just above the teeth, and inserted in the cartilage of the ala of the nose. So it pulls on the ala of the nose downward and laterally. What happens for the nose?
Widen up.
أكنها فتحت. So that muscle, it has two parts. One compressor which is named transverse part, and one dilator which is the alar part. The last muscle regarding the nasal group, Ryan, this muscle, which is named the brachiocepti, attached again from the front of the maxilla, just above the medial incisor, and inserted in the movable part of the nasal septum. What happens? It will pull the nasal septum downwards. So, helping the alar part of the nasalis to make widening of the anterior nasal openings. So, nasal groups, again, we have Procerus, we have nasalis, we have the brachiocepti. Okay? So, this lateral view is specific to show the transverse part of nasalis muscle. And this is the alar part. Okay? Now we will shift for this variation of which muscle can produce this. آخر شوية. Yeah. Which muscle? What happens here? You see? Transverse wrinkling, especially in the lower part of the forehead. So here we have action of proceedings. What happens here in the nose? First compressed, so the transverse part of is it. Okay? Another one. Which part of nasalis? Alar part and the brachiocepti. That's right. Alar part and the brachiocepti. ليه عمل widening the anterior nasal openings. But actually, later we will see in the oral group another muscle help the alar part, making more widening of the nostrils. This muscle later named levator labialis superioris anacaniza. Okay. صعب. ولكن Alright, we have major two muscles. We have encircling the oral fissure, orbicularis oris. Orbicularis oculi, here we have orbicularis oris. Yes. This is orbicularis oris. And on the sides, the main muscle of the cheek, maxillary muscle. Then we will shift for a number of muscles acting on the upper lip, other group acting on the lower lip, including the corners of the nose. About 5 muscles are 2 arising from the zygoma, 1 large and 1 small. Just name the شباب. وتعرف بس تتخيل كده الاكشن بتاعها. We have zygomaticus major, zygomaticus minor. Okay, Hassan. And then we have levator labialis superioris. And then we have a muscle acting on both upper lip and the ila of the nose, rising both. So it is named levator labialis superioris anacanizae, ila of the nose. And then lastly the fifth one, making elevation of the shoulder of the nose. So described as levator angularis. So again, ارجع تاني ورا كده يا ياسر. The first one is orbicularis. Sorry? شباب. The first one is orbicularis oris. Second one, vaccinator muscle, the muscle of the cheek. And then 5 muscles acting on the upper lip. 2 zygomaticus. Zygomaticus major. Lateral in position. Medial to it. Zygomaticus minor, and from their name, who's arising from the zygoma, from the lateral surface of the zygoma, but one posterior to the other. And then we have levator labialis superioris, one pure special for the upper lip, and one acting on both upper lip and the ila of the nose, to make more widening of the anterior nasal openings. Levator labialis superioris And then we have levator labial superioris and acanthocyte. Lastly, one acting on the corner of the mouth, which is levator angularis.
جو واحد.
ببساطة كده, from these 5 muscles, how many muscles acting in pure elevation of the total upper lip? And how many muscles acting on the corners only, making elevation of the corners? Corners. levator angularis من اسمها.
Zygomatic major.
Which one of zygomatics?
Major minor.
أكيد major لأن هي بتتعرف شوية. So, acting elevation of the corner or the angles of the mouth are zygomaticus major and levator angularis. Pure elevation of the upper lip will be carried by minor and levator labial superioris alone or levator labial superioris with anacanthocyte. That's right? So, in the upper lip we have 5 muscles. 2 zygomaticus, 2 levator labial superioris, and we have levator angularis. What about vaccinator muscle? It is the muscle of the cheek. What about its value? Contraction of that muscle of the cheek, it will make narrow area between the cheek and the teeth. متخيل? Otherwise, there is accumulation of the food in that area. Actually, the oral cavity, it has 2 parts. That part of the oral cavity outside the teeth, and the other part to the inside of the teeth, which is more larger. To the inside. So, the inside to the teeth is named the oral cavity proper. The outside to the teeth is named vestibule of the mouth. So, the action of vaccinator is to compress on that vestibule, prevent the accumulation of food in that area. That's why اللي عنده paralysis للفيس muscles أكتر حاجة بيشتكي منها إيه؟ Accumulation of the saliva and the food outside the teeth, out of the vestibule. That's right. Moreover, that muscle is responsible for either suction or blowing of air. So, this is vaccinator muscle. As regards the lower lip, we will see triple muscles. Can we see? 3 muscles acting on the lower lip. One taking the angle downward, so it is named depressor angularis. Another muscle will take the major part of the lower lip downwards. So, depressor labii inferioris. The last one, acting actually on the skin of the chin, making wrinkling of the skin of the chin, rising it. That's why it will make protrusion of the lower lip alone. That muscle is named mentalis. So, arrangement of the muscle of the oral cavity, we have orbicularis oris encircling, responsible for the closure of the mouth and the protrusion of the lips, as we will see in the figures. We have vaccinator, the muscle prevents or helps the process of mastication by compressing the vestibule and prevent the food accumulation inside it. And then we have 5 acting on the upper lip, again, just names. We have zygomaticus, major laterally and minor medially, levator labial superioris alone, levator labial superioris anacanthocyte, and then levator angularis. Downward we have depressor angularis, depressor labii inferioris, and lastly we have mentalis. This is 10 muscles. The last muscle acting on the oral cavity, muscle running transversely on the ankle of the mouth. We can see this muscle is named risorius. So, this muscle is the last muscle, number 11, بقلبه سؤال, acting transversely on the ankle of the mouth. أكنها بتشيل الأنكلز. يبقى بيسموها إيه؟ The smiling muscle. That's right? Okay? We can see and test yourself. Okay? First of all, which muscle?
Transversalis.
Transversal part of the legs. Dilator or compressor?
Compressor.
Okay?
Orbiculis.
Oris, yes. Clear? Which vaccinate? This one, yes. So, this is the muscle of the cheek. Which one? Levator labial superioris. Yes, okay. This one. But this one is? No, acting on the angle. This is zygoma here. This is maxilla. Okay? This is acting on the angle. Starting from the muscle, not from zygoma. So this one is levator angular oris. You see? Okay? Which muscle? Which muscle? Vaccinator. Which structure piercing vaccinator? This is the parotid duct. Okay? To convey the saliva to the vestibule. Yes. نرجع للسلايد اللي قبل كده. As we see, there is criss-cross of muscle fibers of about 8 muscles, making criss-cross just half an inch lateral to the angle of the mouse. The point of criss-cross of the muscle fibers is mixed with fibrous tissue, and in some persons, this fibrous tissue is attached normally to the skin of that area. That's why during contraction of these muscles, there is a depression on the face just lateral to the angle of the mouse. الحاجة دي اللي بنسموها in نافذة كده. This area is named modulus. So what is modulus? It is the area of criss-cross of 8 muscles lateral to the corner of the mouse by half an inch. Sometimes attached to the skin, so making depression during contraction or act of these muscles. Okay? What's this muscle? What is the action here? Collusion and preclusion of both legs. Yes.
Yes.
Again, orbicularis oris. This is the second one. Which muscle making flowing of earth. Vaccinator. So, triple action till now. Prevent accumulation of food and either suction and blowing of air. This is the vaccinator muscle. But here also the lips are closed. So with additional action of orbicularis oris muscle. Okay? Okay? Then the effect ورا لا واحدة.
لا.
Levator labial superioris ده كان يصير. Okay?
Transverse.
Okay. Which muscle?
هذا بيشمل هذا. هذا بيشمل هذا.
Zygomaticus major. Excellent. Yes. Here is zygomaticus major. Which muscle here? Here. There is elevation of the upper leg and depression of the lower leg. So we have levator labial superioris and depressor labial inferioris. That's right? So this is double action. Which muscle?
I'm a boss.
عندي في الأربعة والليفيتور labial superioris ثلاثة نساء. تمام برافو. شفناها في كده.
لا قوم اديني كف.
for the angles. Depress the angles. So we have the depressor angulitis. Yes. Which muscle? Making elevation of the skin of the chin. That's why only the lower lip is protrude forward. لكنه صغير غلط. تعرف
مبوز
muscle is
مبوز
maintains. This one maintains. Okay? Yes sir.
عم اسكت يا عم.
Yes.
سيروز هذه ما اخذناها.
آخر واحدة هنا rectorious muscle. Okay?
This is
Which muscle? Rectorious again up here showing the teeth. So they should depress one.
ليبر
Depress the lip, inferior lip or the lower lip, or elevate the upper lip. But here, what about the action? Is depress of labia inferioris plus resolves. Okay? So now I will shift for the other groups, which are muscles acting on the auricle. Amen.
4 دقائق.
Muscles acting on the auricle. Still we have 5 minutes.
Yeah.
These muscles are attached to that.
أربعة.
The auricle either anterior or posterior or superior. That's why they are described as auricularis anterior, auricularis superior, and auricularis posterior. طبعا these auricular muscles are less developed in the human being, but in animals are more developed for the movement of the ear in different directions. These auricular muscles also involved in the muscles innervated by the facial nerve. What else we have? The occipital bronchitis, and lastly we have that thin sheet of muscle fibers. الناس اللي ذاكرت upper lip كويس على فكرة أنا مش مبسوط من كم الكلام اللي بيحصل أثناء المحاضرة ده. So this muscle actually taken in the pectoral region in the upper lip, as it has origin from the deep fascia covering pectoralis knee. So starting from the front of the chest, this muscle, which is platysma, running the superficial fascia of the side of the neck, and lastly, it takes double insertion in the lower cordon of the mandible, and some fibers continue to be inserted in the angle of the mouth. So this muscle also share in the facial expressions. This muscle, which is named platysma, is also innervated by the common nerve supply, which is facial nerve. Okay? Facial nerve again, by its different branches. Don't forget we have temporal, we have zygomatic, we have upper, lower buccal, and mandibular and cervical to be distributed for. Still, we have the muscles of the auricle, but after removal of the auricle, we have auricularis anterior, auricularis superior, auricularis posterior. Who can, from this figure, this slide inform us what about its nerve supply. Which branches? Facial, but which branch? Posterior auricular get occipital billing plus 2 of the auricular muscles. Auricularis posterior, logic, and auricularis superior. But anterior one take nerve supply from that first branch, which is temporal branch. But see here, the temporal branch supply auricularis anterior and the again auricularis superior. That's why auricularis superior take twice nerve supply. Totally from the facial nerve, but from 2 different branches, from posterior auricular branch and temporal branch. What about this major vessel? As we see, we have 1 anterior and 1 posterior. From the color, yes, we have facial artery and facial vein, and we'll complete inshallah next time.